When I'm talking about too slow, I mean rates in the 60s and 70s. These are almost all from congenital complete heart block. And kids with congenital complete heart block come in two different flavors. One with heart disease, and these are usually L transpositions or some other form of complicated congenital heart disease, or without heart disease, or without structural heart disease. And these are almost all maternal lupus, or antinuclear antibodies that somehow attack the conduction system. But these kids sort of raise a question. Why do these kids with heart rates that are so slow do okay? In utero, the stress response is to increase heart rate, and these kids can't really do that. And there are not very many catechol receptors, so they don't have much of an ability to deal with stress. Why do kids with heart rate do so well? Well, we don't really care much about heart rate. What we're really interested in is cardiac output. And cardiac output is a function of heart rate and stroke volume. And what happens is these kids are just able to increase their stroke volume significantly so they can make up for the deficit in heart rate. When you're born, the work of the heart doesn't change very much. Okay? The work of the heart is generating a pressure and pumping a volume of blood. The old pressure volume loop that you probably learned about in medical school. The work of the heart is the area inside this curve. And when you're born, the pressure doesn't change very much. The fetus is generating a pressure of 70 or 80 millimeters above amniotic fluid as you are when you're born, and the volume doesn't change very much. So the work of the heart doesn't change very much. So these children who did okay in utero with congenital heart block usually do okay after they're born as well. They only get into trouble when they really have to increase their cardiac output significantly, which interestingly can usually deal with feeding and toddling around. In our area, they tend to get into trouble in kindergarten or first grade with town soccer. The kids with congenital heart disease, however, they can get into difficulty much sooner. Because remember, they've really maximized their stroke volume. So even a relatively simple disease like ventricular septal defect, when the pulmonary resistance drops, they start developing a significant left to right shunt. And these kids have already maximized their stroke volume. So they have great difficulty if they do have structural heart disease. So our job as cardiologists or as primary care doctors is to figure out, of these kids with congenital heart block, which have structural heart disease. If they have structural heart disease, then you have to watch them very carefully because they don't tolerate it very well. The ones without structural heart disease, as I mentioned, usually don't get into difficulties in the perinatal period and frequently go long periods of time before actually needing any help, usually a pacemaker.